Today we're going to do some cranial nerve exercises. So we learned about our cranial nerves and now we want to put it into practice in order to help heal from the stress response. So what's going on with the brain. So cranial nerves are an easy way to access the brain, as you can see by the picture of the cranial nerves and where they are and what's going on with them. So let's first think about what happens in a stress response, right? So if we see something out of the corner of our eye, let's make it something super simple and not so mean. Maybe a baseball is coming at us and we need to protect ourselves, right? So we're going to do this action right here. So that rubrospinal tract, right? So that flexion protection response. Our shoulder just went up into our ear. A lot of us walk around kind of crooked. We wonder why. We work on that shoulder. It's not going to do it because it's a neurological program for stress, right? And it's part of this fight or flight where we go into our front foot forward and our back foot back, right? And our shoulders kind of hunch up in one way or the other. And then we're going to crunch into here so we can fight or we can run. So the idea is to de-stress, right? So get adjusted and get your structure aligned up a little bit better, alignment. And then what we want to do is neurologically program in this kind of new de-stressed program, kind of set and hold neurologically that we're okay and that we're safe. So this concept here, right? So my face crunches up, my jaw is going to clench down. So we now know what cranial nerves are doing that. So facial nerve, trigeminal for the clenching of the jaw, all sorts of things going on. And then if we were to just get a little startled, right, we might just look around like, what was that, right? What's going on? Eye movement. So cranial nerve 2 for sight, 3, 4, and 6 for our eye movements themselves. And then the idea of this kind of response here. Okay, so really none of our cranial nerves are safe from the stress response, and then that'll give us that kind of gut feeling and upset our stomach and all sorts of things. So we might also have issues with balance because our cranial nerves are involved, and we have that vestibular cochlear nerve as well. So that kind of lockdown response as opposed to the free flow of proprioception and where we are in space and the safety of that. So we want to dial it back. So we get adjusted, right, in order to alleviate the structural misalignments and to start to activate the mechanoreceptors to alleviate pain and stress at the cord level and just general nervous system stress. And then we want to set and hold our new safe program. So we're feeling safe, we're feeling happy, we're feeling pretty good, and then we want a new program in there. So we don't want that stress program. So we're going to just go through the 12 cranial nerves, right? So one nose, two eyes. Cranial nerve number 1, smell. Okay, this is why aromatherapy works. So make your environment smell good. So I have a couple of things here that I have in my home. I'm doing this from my home because this is the quarantine time for COVID 2020. So this, I do cupping. I love these cups. See how they are. You've got your little fingerprints here for traction. So I just put my sage in here. So we like sage to clean the air. So spiritually, it's thought to get rid of negative energy. It was ritualistic that way and still is to this day among many energy workers and Native American tribes and such. And then they would try and cleanse the air of evil spirits and then burn sweetgrass in order to get good, clean spirits. But in the science world, we know that this will actually help to clean some of the germs out of the air. It smells good, and then it makes my lungs feel nice and good, and that I'm doing something for that. So one of the things I do is I just take a little piece here and I start it on fire. Okay. Start it on fire, and then get a little scent. Okay. My practice also used to be called Sage Chiropractic Center because it's synonymous with natural healing, with wisdom, and with cleansing the old and bringing about the new. So it's kind of nice to kind of set the tone, get your environment to smell good. If you don't have that, I like essential oils. This one is lavender. So you can put that in your diffuser if you like. This one's peppermint, kind of nice. And then I've got thieves oil here. because again, it is the time of COVID, so making sure that the immune system and the lungs are functioning appropriately. So one of the things that you can do, so I'm going to take peppermint for a cooling sensation here, and so I'm going to do alternate nostril breathing. Okay, so this is a yoga technique, and I'm going to use the sense of smell along with that. So we take our fingers like this, kind of hang loose sign, right? And on the beach, right? Why not? Not that you can see the beach from here, but the beach is right there. And so I'm going to take my little hang loose sign here. I'm going to press it on my nostrils here. Okay? My fingers are freshly washed. I haven't been outside today, right? So I've been safe at home. So I'm going to take my thumb here. I'm going to breathe in. And then I'm going to close this nostril here and breathe out the other nostril. And then breathe in. Switch nostrils, breathe out the other nostril. Back and forth. Okay, it takes a little coordinated effort as well, so a nice little neuro exercise for that as well. To balance yourself out, switch hands. And out. Switching to go out. Just a couple times here because we're going to do all 12 cranial nerves. So you can hang out with any one of these that you like. So I picked peppermint to kind of free up because I have a little bit of a sinus issue going on with allergies because it's springtime. So we've also got the sage going here. So that's cranial nerve number 1. So set the stage with making things smell good. We like it when things smell good. It puts us at ease. It's going to hit up the limbic system. It's going to go through that olfactory tract and into that amygdala and into hippocampus and into this area of our limbic system that's going to emotionally relax us. Okay? So the neuro behind that is pretty clear. That smell helps us with understanding that we're safe or if we're not. So one nose, 2 eyes, so sight. So we're looking, obviously, at, we're going to have our eyes open. We'll also have our eyes closed to play around with cerebellum versus dorsal columns, which is not cranial nerves, but we throw it in here anyways. So sight here. So we're going to then combine 3, 4, and 6. So the eye movements. Okay, so 3, remember all others are 3, so all of our eye movements for our cranial nerve 3, except for SO4, superior oblique, and LR6, which is abducens nerve, which is looking out to the side. So we're going to just follow our own finger, right? Up, down, to the side, up, down. We call that an H pattern. Come back into center. Follow your finger towards your nose. Okay? We're testing SO4. It's a tricky little nerve and muscle that we are checking here because it does a different action, but this is how we test it. So I sometimes have trouble, a little diplopia or double vision when I do this with my left eye is my tricky eye here. And so what I do is I play around with the VOR, the vestibular ocular reflex, and I'm going to hold my drishti as the camera lens here. I'm going to stare at it and move my head. So if my eye can't go in this way, right? So initiation of movement with the eye itself in towards the nose, I'm going to go along a different start pathway to get the eye to do that as well, but the eye will look like it's staying still, but my eye muscles still have to bring it in towards the center. It's a little trick. And so we do that a couple of times. Okay, do the other side just a couple of times as well. And then we can play around with moving in different directions, holding our gaze on our drishti or our focal point. Okay, so playing around with the VOR. And then we want to do this with our eyes closed as well. So balance with eyes open is our cerebellum. Balance with eyes closed is going to be more of our dorsal columns, or the fasciculus cuneatus and fasciculus gracilis. So I want to close my eyes and do the same movement. So go ahead and close your eyes. Look left, center, right, center, up, center, down, center, out into the four corners. So like you're tracing a square with your eyes. And now pretend like you are bringing your finger to your nose and trying to follow it. Okay, and back and forth. Okay, switch fingers. Oh, good. And open the eyes again. Okay, so kind of look around a little bit and get right back to it. So go ahead and close the eyes and do your VOR. So try and keep your focal point on the same thing you had it before. So mine would be the camera lens. And do your eye movements with your eyes closed. Okay, so it kind of throws you off balance a little bit. I use this one to know when I need to be adjusted. I get checked all the time. I get checked about twice a week just because I'm high maintenance, high performance, right? But I can tell that my suboccipitals on my right are at issue right now, so an adjustment would be a good idea. Okay? So just kind of checking in with your body that way. So we've done cranial nerves 1, 2, 3, 4, and 6. So cranial nerve 5, so we know that that's trigeminal. So that's going to be sensation of face. Okay? And then it's going to also be chewing as well. And so one of the ideas behind this is that we clench our jaw when we're stressed. So like a dog growling in order to tell you that it's stressed out and needs some space, right? And so you can do some simple, just light chewing exercises. Okay, wiggle back and forth. Chew, chew, chew. Okay, release the jaw a little bit. And then you can also do some light kind of facial massage here as well. So that's going to be trigeminal and facial nerve as well. Okay, so nice little, you can tap. Okay. Just something kind of calming and relaxing. Okay, there you go. And on this note, we're also going to go to the ears as well. So when we look at that picture, there's a lot of cranial nerves affected by the ears. So nice little rub at the front here, and then a little bit of a rub around the ears. Make it feel good. Don't be rough. My right ear is clicking a little bit. That's normal. And just moving stuff around. Go nice and gentle. Go to the earlobes. Go up top, back behind. Get into that mastoid process. Okay, so it feels kind of good to move around a little bit. Okay, and then give the head a little scrub as well. Okay. Nice and relaxing. Okay, so nice facial nerves. So lift your eyebrows up. Smile, get lots of wrinkles in there going on. Okay, puff out the cheeks. Okay, like a fish, right? I'm just playing. Smile, lift the eyelids, lift the brows. Okay, back and forth. Vestibulocochlear nerve. So what we want to do here is we want to balance. Okay, so some of us have some issues with balance, and we want to make sure that we are addressing that. So one of the things that we can do as well is going to be that VOR addresses that. So we can just sit if we are having issues with balance and maybe in a wheelchair or a walker or some sort of other balance challenge. So that VOR actually addresses that as well. Okay, so, and then we're looking at glossopharyngeal, vagus, accessory, and hypoglossal. And so what's going on here is a lot of tongue, right? So tongue action and taste, right? So 7 is sweet, 9 is bitter. And when we're stressed, it's you know, a common thing for somebody to overeat, especially sweets or salty stuff, in order to kind of facilitate that parasympathetic response of trying to get into rest and digest. Or some of us can't eat at all. So you could chew on a piece of gum, you could have a lozenge of something healthy, or you can do some tongue exercises. So these are always a funny looking one. So I like to smile. Okay, and then stick out your tongue. Okay, and then do your eye movements at the same time. Totally nuts looking, right? So nobody's watching you. They're all watching me though, so it's okay. So stick out the tongue, and then move your eyes. Okay, so left, right, up, down. Close your eyes, stick out your tongue. Left, right, up, down. Good. And then go ahead and open your eyes. Okay, so one of the things we also want to do is activate the parasympathetics for vagus nerve. So this is an old technique that I learned from some retired chiropractors, and it's called neuroorganizational technique, and we called this one valves, like, you know, ileocecal valve, things like that. So you go to the belly area, and you think about the hiatal hernia area here, or just underneath that xiphoid process. So really gentle area here to kind of stroke down, and in a we're always going to go in a clockwise fashion here. Really, really gentle. We're not actually setting any alignment here. We're just lightly stroking the skin here in order to activate the nervous system. And then come down onto the left side here for stomach and spleen. Okay. And then into the left lower area here for that diverticulitis point, or valva Houston. And then come across that transverse colon, and then go to your right ASIS, or your right hip point, and your belly button, and go halfway in between here. Okay? That's where your ileocecal valve, or your appendix, is going to be. Okay? So your right ovary, if you have ovaries, is going to be there too. Okay? So give that just really gentle, light, clockwise sensation. Come up to liver, gallbladder. Kind of rake the ribs a little bit, go underneath there, and then do it again. So in a nice clockwise fashion. Okay. Transverse ileocecal valve. Let's do it one more time, all the way around. Okay, that vagus nerve goes to our internal organs. And then a little tricky spot here is you go to, I don't think you can see me here, the leg, and you sweep down the leg. Just part of the technique. It's called a neurolymphatic point. So you just sweep down the leg. Probably has a little bit to do with gallbladder, if you ask me. But there you go. So that is something that we can do to help with vagus nerve. Okay, we can also come through here and kind of gently release the neck. Okay, this area here. And then we already worked with our tongue. Okay, so in yoga we have lion's breath, where we stick out our tongue and we go, right? So that was pretty weak, so I'm going to do a little louder. Okay, much better. So it releases heat and it releases tension from the tongue, and the digestive tract is the idea behind that. So that's our cranial nerves. So many times what I'll do after exercising is I'll just do my eye movements, left, right, up, down, out to the four corners, and then finger towards the nose. And then something else I like to add in is what I call the rainbow. So I like to look up in this arch, back and forth. So we don't really normally like to look up anymore. So that's a good one to practice. And then we do it with our eyes closed as well. So left, right, up, down with eyes closed, and then towards the nose, and then rainbows back and forth as well. So that's the cranial nerve exercises. And then I like to do just a little cross crawl. So lifting my right arm up and my left leg up at the same time, that you can't really see here, and then looking away from my arm. So we remember that we don't want to smell our own armpit. And that's going to help with that SCM and that upper trapezius. So cranial nerve 11, and then shoulders down and back. So inhale up, exhale down and back. Inhale up, exhale down and back, and one more time, cross crawl. So lifting the opposite leg as arm, turning the head, activating SCM and upper trap, and take a breath. Inhale all the way up. Exhale down. Inhale all the way up. One more round. That's our cranial nerve exercises for the day. I hope you enjoyed them, and I'll see you for our next exercise tutorial. Thank you.